at 2 p.m. on Wednesday, the 14th of October, 2020. Can I please remind you all to switch your phones to silent for the duration of the meeting? In addition, can I refer you to the protocols for remote meetings which have previously been circulated, namely, your microphone should be switched. Your microphone should be switched to mute unless you're speaking. The Democratic Service Officer will take a roll call at the start of this meeting of all members and officers present. Should you wish to speak or ask a question or a comment, can you please indicate either via the chat function or by raising your electronic hand via Teams. I'll assume that you've all read the paperwork before us today prior to the meeting. When speaking, please can you also introduce yourself. I'm Councillor Scott Jones, the Mayor of Neath, Talbot. And Jane, when you're ready, could you kindly take the roll call, please?
Yes, Mr. Mayor. Councillor Aubrey.
Present.
Councillor Bamsey.
Present.
Councillor Causey. Councillor Causey. Councillor Helen Clark. Councillor Clark. Are you muted, Councillor Clark?
Yeah.
Councillor Clement Williams.
Present.
Councillor Matthew Crowley.
Present.
Councillor Arthur Davis.
Present.
Councillor Nicola Davis. Councillor Nicola Davis, are you on mute? Councillor Oliver Davis.
Present.
Councillor Rose Davis.
Presennol. Present.
Councillor Colin Edwards.
Present.
Councillor Jamie Evans.
Present.
Councillor Sharon Freegard.
Present.
Councillor Galsworthy. Are you on mute, Councillor Galsworthy? Because I thought I'd seen you. Yeah, you are on mute, Councillor Galsworthy, but I can see you here.
Present. Yeah, present. Sorry.
That's okay. Councillor Wyndham Griffiths.
Present.
Councillor Joe Hale.
Present.
Councillor Sian Harris.
Present.
Councillor Mike Harvey.
Present.
Councillor Nigel Hunt.
He's in the chat, Jane, saying that he's here.
Oh, thank you. Councillor Steve Hunt.
I'm here.
Councillor Jeremy Hurley.
Present.
Councillor Hugh James.
Present, Jane.
Councillor Chris Jones.
Present.
Councillor Doreen Jones.
Present.
Councillor Hugh Jones. Councillor Hugh Jones, are you on mute? Councillor Jane Jones.
Present.
Councillor Leanne Jones.
Present.
Councillor Simon Noyle.
Yes, I am here. Thank you.
Thank you. Councillor Ted Latham.
Yeah, present, Jane.
Councillor Alan Llewellyn.
Present, Chair.
Councillor Alan Lockyer.
Present, Jane.
Councillor Adam McGrath.
Present, Jane.
Councillor John Miller.
Present.
Councillor Sandra Miller.
Present.
Councillor Ridgeon Mason.
Present.
Councillor Del Morgan.
Present.
Councillor Suzanne Paddison.
Present.
Councillor Sheila Penry. You're on mic, Councillor Penry. I've seen you, so I know you here. Councillor Martin Peters.
Present.
Councillor Rebecca Phillips.
Present.
Councillor Mark Prothero.
Thank you, Jane. Yes, I'm present.
Councillor Lynette Purcell, are you here? Councillor Sean Percy.
Present.
Councillor Cypher Harman.
Present.
Councillor Peter Rees.
Present, Jane.
Councillor Suzanne Renkes.
Present.
Councillor Sonia Reynolds.
Present.
Lovely. Councillor Anthony Richards.
Present.
Councillor Peter Richards.
Present, Jane.
Councillor Marcia Spooner.
Present.
Councillor Anthony Taylor.
Present.
Councillor Rachel Taylor.
Present.
Councillor John Warman. I think you're on mute, Councillor Marbrack. I know you here. Councillor Whitelock.
Yeah.
Present, Jane.
Councillor Chris Williams.
Present, Jane.
Councillor, the leader, Councillor Rob Jones. I know you here, leader.
Yes, I'm here.
Councillor Dennis Keogh.
Yes, I'm here.
Councillor Annette Wingrave.
No apologies tender, Jane.
Thank you. Councillor Robert Wood.
Present.
And Councillor Alwyn Woolcock.
Present, Mr. Mayor.
Thank you. I'll go to officers now. Stephen Phillips.
Present.
Karen Jones.
Present.
Howard Jenkins.
Present.
Andrew Jarrett.
Present, Jane.
Nicola Pierce.
Present.
Arlid Evans.
Present.
Sheena Rees.
Present.
Craig Griffiths.
Present.
Stacey Curran.
Present.
Is there anyone else present today that I haven't called the name out? Right, that's it, Mr. Mayor.
Sorry, Jane, I was late coming in.
Sorry,
Councillor
who's
Nicola
that?
Davis. Councillor Nicola Davis.
Oh, right, great. Thank you very much. Thank you. There we are. That's it. We're all ready now then, Mr. Mayor.
Okay, thanks very much, Jane. Okay, we'll move on to agenda item 1, a mayor's announcement. Can I say it's with great sadness that I advise council of the death of the former mayor and councillor, Mrs. Val Kingdom of Talbot Borough Council. As a mark of respect, can I ask council to observe a minute silence, please? Thank you, members. On a different note, it gives me great pleasure to advise council that Mrs. Joy Smith, Road Safety and Business Performance Manager, has been made a member of the Order of the British Empire for services towards road safety. Also, Mrs. Hilary Dover, Service Director of Primary Care and Community Services at Swansea Bay University Health Board, has received a Medal of the Order of British Empire for services to the National Health Service during COVID-19. Other recipients who have been awarded a Medal of Order of the British Empire are Mrs. Julie Simpson, Community Branch Director, Santander, for services to the financial sector and community of Neath. Also, Mr. Christopher David Singletree for services to veterans, their families, and the armed forces of Talbot. Moving on to agenda item 2, members' interests. Are there any interests to declare? If so, please can you indicate by raising your electronic hand via Teams or indicate in the chat function, and when called to state the details. The Democratic Service Officer will then forward an electronic version of the Declaration of Interest form to you to complete and return back to the relevant officer. So can I ask, is there any members' interest, please?
I can't see any, Mr. Mayor.
Okay, thanks very much. We'll therefore move on to agenda item 3, minutes of the previous meeting of council. I refer to the minutes of the previous meeting held on the 23rd of September. Before I move confirmation of their accuracy, can I ask if there are any comments on the accuracy of the minutes, please?
I can't see any hands raised, Mr. Mayor.
Thank you, Jane. Okay, I now move confirmation of the accuracy of the minutes. Can I please have a seconder?
I second, Mr. Mayor.
Thank you. If you do not indicate to the contrary, it will be assumed that you are in favour of the recommendation. Jane, could you kindly please confirm with each member who has indicated whether you're against or wish to abstain, please?
I can't see anyone with their hands up or so no, nothing received, Mr. Mayor.
Okay, thanks very much. Therefore, we'll move on to agenda item 4, the Corporate Plan 2019 to 2020 Annual Report. This report was commended to Council by the Cabinet on the 30th of September. I'd now like to call upon Leader of Council to introduce the item, please.
Thank you, Mr. Mayor. I'm pleased to present this afternoon the annual report for the 2019 to 2020 to Council. Can I remind Council that this is a retrospective look of a report that's already happened. This annual report focuses on the progress made against our 3 wellbeing objectives, which were set out in the Corporate Plan Shaping NPT, which was published by Council in April 2019. The detail of the progress made is set out in the circulated report, which members will have had time to consider. Additionally, the report has been reported to Cabinet before being presented here today. Overall, we've achieved most of what we've set out to do during 2019 and 2020, and the report shows that 82% of the steps that we set out in the corporate plan to improve well-being are on track, compared to 83% in the years 2018 and 2019. In terms of performance, the report shows where comparable data is available, 63% of our indicators improved or maintained performance in the 19-20 year, compared to 44% in the 18-19 year. And 54% of our performance indicators achieved targets in both these financial years. Every year we compare our performance against other local authorities in Wales using the national set of public accountability measures known as PAMs. However, due to the pandemic, this data has not been collected nationally, so we are unable to undertake that comparison for the year 19 through to 20. However, our own performance for those measures has been included in Appendix 3 of the report. So now, Mr. Mayor, I will share some highlights with Council today, what has been happening and what we've delivered during the years 2019-2020. We saw more than 1,000 working parents across Neath successfully apply for the childcare offer in Wales. The youth service engaged with over 6,700 young people, and our net figure, not in employment, education or training, which measures the percentage of young people not in that sphere, reduced by 2.15%, and this is the lowest figure we've had for Neath Talbot. Over 21,000 children and young people took part in the road safety education and training initiatives, and our regeneration programme continued. Work has started on the development in Neath Town Centre, and plans are underway to develop the Plaza Cinema in Port Talbot. 610 jobs were created or safeguarded as a result of the financial support, which is a 34% increase on the previous year. And more than 1,400 people were helped back into work, training or volunteering through our Workways Plus and Communities for Work schemes. We supported 34 businesses startups through the Council's Innovative 8 programme, and 97.4% of all planning applications were determined on time within the 8 weeks. Given the cuts in financial and human resources over a sustained period, it is quite remarkable that we continue to deliver core functions with significantly fewer people than we had available to us in the past. And I certainly appreciate the tremendous commitment of our workforce and our trade unions in delivering the performance outlined in the report in such challenging times. Those challenging times were further exacerbated in the middle of March when we mobilised the emergency response to COVID-19 on a national emergency basis. I am immensely proud of the way that this Council's workforce and our communities have adapted to these severe restrictions that were placed on us all at that time. Those restrictions continue, and I will give Council an update on COVID at the end under a separate item. But the efforts across the County Borough to sustain critical services and to support those most at risk were extraordinary. and I'm sure everyone in council will support that statement. In preparing the annual report, the council is required to consider whether the current wellbeing objectives remain relevant or whether changes to the objectives should be considered. Given that the objectives were agreed in September 2017 and again reviewed in March 2020, it is not considered necessary to make any changes at this point in time. To conclude, Mr. Mayor, the report is before council for adoption this afternoon, and when you are ready, I would like to move the recommendations as set out on page 10. Thank you, Mr. Mayor.
Thank you, Leader. I've had an indication from Councillor Steve Hunt, so I'll call Councillor Steve Hunt, please.
Thank you, Mr. Mayor. Can I also thank the Leader for this brief update on this plan, and I fully support the actions and the comments he has made in this meeting today. Just one little query to the Leader, if I may. We do know, and I know we're having an update on the COVID situation at the end of this meeting, but it'd be remiss if I didn't mention at this stage, do you envisage some of the plans, and you mentioned the Neath town development, which obviously we all welcome, probably long overdue, but eventually we are getting there. Do you envisage any issues or problems given the current financial implications that COVID is giving us as an authority in any of these projects not coming to fruition as we go forward with our plans in the near future? Thank you, Mr. Mayor.
No. I'll pick it up when I give the COVID report, Steve, but the short answer is no, not at this time.
I've received an indication from Councillor Alan Llewellyn. Councillor Llewellyn, please.
Just Mr. Mayor, I'd like to thank Councillor Rob Jones for introducing the report and for us all having a copy in advance. Obviously, it's been scrutinised in cabinet scrutiny, and there's quite a good discussion there on the report. So I'm sure we'll be in a position to support it this afternoon. My question really is on, obviously this is a report on the corporate plan retrospectively, as was stated in the introduction, and it's based on the 3 wellbeing objectives. I would agree that the objectives are continue to be relevant, but obviously we are facing some perhaps the word is overused, really unprecedented, but it is unprecedented challenges for the work of the authority and for local government as a whole. So while the authority has successfully completed large sections of the 3 wellbeing objectives for the previous year, can I ask the Leader of the Council if he anticipates what issues he anticipates in being able to deliver these wellbeing objectives during the course of the current year and going into next year? For instance, we are due to review the local development plan, which is key in shaping the future of the authority, and obviously there have been constraints on our ability to move forward with that, particularly in terms of public participation and consultation. As Councillor Steve Hunt already mentioned, the Neath Town Centre development. But I'd just like a comment on how we are approaching delivery of the corporate plan under the current circumstances. Thanks.
Thank you, Councillor Llewellyn. The retrospective look at the report is as is, but these were reviewed by Cabinet and Cabinet scrutiny as far as the wellbeing objectives were concerned. And at that point, which, as you were aware, because that only took place a couple of weeks ago, at this moment in time, there was not felt the need to change those 3 wellbeings for the current year that we find ourselves in. As is, it's always subject to scrutiny and review. And as is, if there is a requirement to change it because of change of circumstances that we find ourselves in with COVID, then that will be looked at. But I think it's more important that when we get to the other side of Christmas, is that we then start looking at the wellbeing objectives going forward in the plan for 2021, 21-22, sorry, and then the respective look back at whether we continue with these wellbeing objectives or they need to be tweaked. But the wellbeing objectives are fit for purpose within the plan as it currently stands.
Thank you. I've received no further indications from members, so therefore can I refer members to the recommendation on page 10 of the report. It is recommended that the draft corporate plan 2019 to 2022 annual report, full progress report, the draft corporate plan 2019 to 2022 summary report, and the corporate plan key performance indicators 2019 to 2020 as attached in the circulated report be approved. That no changes be made to the Council's wellbeing objectives at this time. That the Leader of Council be given delegated authority to make such changes as may be needed to the annual report prior to publication, provided that such changes are not materially altered the content of the document considered by Council. Therefore, can I ask for a proposer, please?
I move, Mr. Mayor.
Thank you. And a seconder, please.
Second, Mr. Mayor.
Thank you. If you do not indicate to the contrary, it will be assumed that you were in favour of the recommendation. Can I ask Jane if you would kindly confirm each member who has indicated whether they're against or wish to abstain, please?
You're on mute, Jane.
Sorry, Mr. Mayor. No one has indicated, so that recommendation now has been approved.
Okay, thank you. Therefore, we'll move on to agenda item 5, voting arrangements for officer appointments determined by virtual meetings of the Council. Can I now call upon Mrs. Sheena Rees to introduce the report, please?
Thank you, Mr. Mayor. I just want to briefly add to what's been set out in the report that's in front of you. Firstly, I'd just like to say that Jane has worked with Spencer and IT to very quickly develop this digital solution to voting for the Special Council. So I really thank Jane for taking that work forward. I think it's a fantastic piece of work that they've done in a really short space of time. Since we wrote the report, we further worked on the process. So we want to provide assurance to members around the confidentiality in the process. Obviously, that's really important. So this is subject to the pandemic, but our plan is on the days of the Special Council, so the one in November for the Chief Exec appointment and the one in December for the Director of Education appointment, myself, Craig, the Head of Legal, and Jane from Democratic Services, we're intending to co-locate. The outcome of the digital questionnaire will go to one PC in Talbot Civic. The three of us will ensure that we only access the data that we need to. So we need to know that every member.
So, sorry, Mrs. Rees, you've been muted for some reason.
Sorry, I've just realised that. Oh, okay.
It's only the last 10 seconds.
Oh, okay. Right. Sorry about that. I don't know why. Did we get to the point where myself, Craig, and Jane were co-locating in Talbot Civic? Great. Okay. Yes. So we're going to co-locate. The outcome of the digital questionnaire will go to one PC. The three of us will ensure that only the data that we need to access is accessed. So that will be that every member has voted and that every member has voted once. That in that way, we can contact any members who haven't voted and help them to do so. What we won't access is the page in the database that shows us how members have voted. Once we've completed that exercise and we've assured ourselves that every member has voted and voted once, then we will delete the information that we no longer need to keep. So we'll keep a record of the number of votes and the number of votes for each candidate, but we won't keep any other information. So that's just to provide a bit of assurance to members around that process. Obviously, that is dependent on us being able to co-locate. So I'm just saying that as a caveat, but certainly at the moment, that's our intention. I'm not intending to say anything else on this report, so happy to take any questions, Mr. Mayor.
Thanks very much, Mrs. Rees. I've received an indication from Councillor Hunt, so Councillor Steve Hunt, please.
Yeah, thank you, Mr. Mayor. Very quickly, Sheena, just for clarity, this process will only apply to those at the meeting on the Teams when it takes place. because you mentioned there go out to all members to check if they voted or not. It's not going to go out to members that did not attend that meeting. That's just for clarity. Is that correct? Thank
Yes.
you, Mr. Mayor.
Thank you, Councillor Hunt. That's a really important point. Yes, it will only be members who are present at the council meeting who will be entitled to vote.
Thanks very much, both. I've had an indication from Councillor Del Morgan. So, Councillor Morgan, please.
Thank you, Mr. Mayor. If members approve this today, and I will support it, can we please have like a dummy run so that we can test it out with, with false data, so to speak? Then we'll have more confidence, I think.
Okay, thank you, Councillor Morgan. You've just reminded me that Jane had asked me to ask all of you if you would be happy to take part in a dummy run at the end of this meeting. So Jane is going to be putting a link in the chat bar, and she'd like you all to use that link to vote. And I think you're going to vote on whether you've enjoyed today's meeting or not.
Thank you.
Okay, thanks very much, Mrs. Rees. So as the request has been made, if as many members are able to stay at the end, we'll be truly grateful. I haven't received any further indications regarding any further questions or comments. So can I therefore refer members to the recommendation on page 162 of the report? Can I ask for a proposer, please?
I move, Mr. Mayor.
Thank you. And a seconder?
Second, Mr. Mayor.
Thank you. If you do not indicate to the contrary, it will be assumed that you are in favour of the recommendation. Can I now call upon Jane, who will confirm with each member who has indicated whether they're against or wish to abstain? Sorry, Jane, you're on mute. You are, sorry.
Sorry, Mr. Mayor, no one has indicated. So that has been approved. Can I just also add as well, Mr. Mayor, what Sheena was saying, that the survey will be sent out tomorrow, not after the meeting.
Yeah, no problem. Thank you for the clarity. Okay, we therefore move on to agenda item 6, changes to member representation. This report was commended to Council by Cabinet on the 30th of September. Are there any questions or comments? Please indicate. I can't see any. Nope.
I can't see other, Mr. Mayor, so that again has been approved.
Thank you, Jane. I now refer members to the recommendation on page 170 of the report. It's recommended that the Council approves that Councillor S. Percy fills the vacancy on the Voluntary Sector Liaison Forum. Can I ask for a proposer, please?
Move, Mr. Mayor.
Thank you. And a seconder, please.
And second, Mr. Mayor.
Thank you. Again, if you do not indicate to the contrary, it will be assumed that you are in favour of the recommendation. Can I call upon Jane, please, who will confirm each member if they've indicated whether they're against or wish to abstain, please?
No one's indicated, Mr. Mayor, so that has been approved.
That's great. Thank you. Okay, we'll move on to agenda item 7, appointment of the Director of Education, Leisure and Lifelong Learning. Can I call upon Mrs. Rees to introduce the report, please?
Thank you, Mr. Mayor. The report is seeking authority to advertise the post of Director of Education Lifelong Learning upon the retirement of Mr. Aled Evans. Advertised in October, this should enable us to make an appointment in December, which means that any prospective suitable candidate will be able to take up the post seamlessly and once Mr. Evans has left his post.
Thank you, Mrs. Rees. Councillor Alan Llewellyn, I seen an indication. Your hand went up, but it went immediately back down. So are you indicating to speak, please?
Oh, yes, yeah. Sorry, I thought you were still up. Very, very briefly, I know we'll have an opportunity, closer to the time to refer to Alan's authority, and that'll be more appropriate closer to the time. Certainly support the process. Can I just check? because we're talking about officer appointments, can I just check what Jane just told us a bit earlier about the survey taking place tomorrow, not after this meeting? Is that the survey that Sheena referred to, the trial run, whether we've enjoyed this meeting or not? I just want to be sure we're talking about the same thing.
Yes, that's it.
There we are. So there won't be an event on at the end of this meeting then?
No.
Okay, yeah, thank you.
Okay, thanks very much. I've received no further indication from members with regards to any further questions or comments. Can I therefore refer members to the recommendation on page 174 of the report? Can I therefore ask for a proposer, please?
Move, Mr. Mayor.
Thank you. And a seconder, please.
1 second, Mr. Mayor.
Thank you. If you do not indicate to the contrary, it will be assumed that you're in favour of the recommendation. Can I call upon Jane to confirm whether any members wish to abstain or to vote against, please?
Mr. Mayor, I can see no indications at all, so that has been approved.
Okay, thank you. Okay, therefore we'll move on to agenda item 8, notice of motion. I can confirm that none has been received. We move on to agenda item 9, any questions under rule 9.2. I can confirm that there is none received. We'll move on to agenda item 10, urgent items. I'd like to call upon Leader of Council to address Council with an update regarding COVID-19, please.
Thank you, Mr. Mayor. To pick up on Councillor Stephen Hunt's point in relation to our infrastructure projects, our Neath Town Centre development continues. The plaza is coming along at pace. Our Band B schools, Kevin Syson, Neath Abbey, and the rest of the Band B scheme are moving. We are still dealing with our flood issues around the county borough, and we are continuing to be active in relation to these large infrastructure projects. It's no good this council sitting here sucking its thumb, waiting for COVID to finish, and then waking up on a Monday morning and then look to decide what we are going to do. We therefore are continuing with these projects. The monies for these were ring-fenced and allocated within our budget. And although COVID has in fact put a tremendous strain on our finances, these projects will continue, subject to any further instructions, guidelines, or any other measures that either are brought in at a national or a Welsh level. I think that's sufficient to perhaps put council's mind at rest that we are trying to be a normal as possible council, trying to secure jobs going forward, particularly in industry, and still planning for the future to deliver on the plans that we set out at the beginning of this council. But I did update council at our last meeting on the 23rd of September on the latest position, and at that time the rate infection for the county borough was 18.1 cases per 100,000 population, and the positivity rate was 1.3%. But just a few days later, on the 28th of September, and given that the infection rate was just below the threshold of 50 cases per 100,000, Welsh ministers determined that local restrictions should be applied in the county borough with a view of suppressing the spread of infection. What we all must remember as far as these figures and data is concerned, it's all retrospective. And even to the point of on the Monday evening when we were put into lockdown under a local restriction, it is more than likely to have been above the threshold at that time, and therefore would have automatically gone into some form of lockdown the following day based on the day before's figures. So since the lockdown came in, and it was with a view of suppressing the spread of infection, travel outside the county boundaries for residents is restricted, and unless there is a reasonable excuse, generally people can only socialise with people that they live with, although there are some exceptions to that, and licensed premises must stop serving alcohol by 10 p.m, which includes off licenses and supermarkets. The policy to work from home whenever this is possible also remains in place. But over recent weeks, there has been an extensive work undertaken by the TTP, the Test, Trace and Protect Service, to contain the spread of the virus. And there has been further increases in the volume of communication issued, highlighting the reason why infection rates continue to spread. Those members who attended the recent TTP members seminar would have received a lot more detail of the arrangements in place to protect the public health of local people. Regrettably, despite all of this effort, there are still too many people mixing together and not observing social distancing and other health protection measures. By yesterday of this week, the infection rate for Neath Talbot has risen to 128.4 cases per 100,000 and a positivity rate of 9%. That is, people who take a test that are testing positive. The pattern is being repeated across many areas of Wales and in other parts of the UK, and it must be of a concern to all of us. The imposition of an additional restrictions is under active consideration by ministers to prevent further spread of the disease and more families losing people that they care about. Many of you would have seen or heard the rumours on the media today about a circuit break or fire break not only being considered in Wales, but in the wider community of the United Kingdom. It is in anticipation that we will likely see a worsening of the position in recent weeks. Businesses, continuity plans and emergency response arrangements have been reviewed. This has included issuing advice to local social care providers on the need for them to review their risk assessments to protect those within their care, the deployment of mobile testing units around the county borough to increase access to testing, a communication out to all businesses in the area, as well as working with our communities to ensure that we can reach out to those who are most vulnerable through our Safe and Well initiative. But I need to stress to Council that the previous reiteration of Safe and Well will not be the same going forward as it was when we first kicked off in March with the COVID pandemic. The Council is working hard with the Health Board to protect our communities. However, in the final analysis, each and every member of our community has to apply the simple measures of washing hands frequently, keeping social distance, wearing face masks when required, and even if people have the mildest of symptoms, they must immediately self-isolate with the people they live with and get tested. These may be simple measures, but if they're applied consistently in all parts of our daily lives, this will provide the means to reduce the infection rates, protect the most vulnerable people within our communities, and lift the restrictions on our daily lives sooner rather than later. This Council can do much, but it's the community that will make a difference. Please remember, COVID-19 kills, but those deaths are not inevitable and can be prevented. Thank you, Mr. Mayor.
Thank you, Leader. I've received two indications. Councillor Carolyn Edwards. So Councillor Edwards first, please.
Thank you, Mr. Mayor. As I'm Carolyn Edwards, many councils are now providing maps with a breakdown of incidences in each of their areas. And I do realise that the leader has already been contacted by Councillor Llewellyn about this. I'm concerned because my area had an increase of COVID-19 within the last 2 weeks, resulting in the closure of the local mine. Now, I've no criticism of officers, as I know how hard they're working. But the first I knew about this incident was when a resident rang me to complain that the mine was still open and the workforce were shopping locally and not isolating. I was relieved when I finally managed to make contact with officers that the matter was very much in hand and under control. But if ward members were informed immediately about a spike in cases, we could alert our residents via our social media pages and so on, and urge them to follow all the guidelines, just as the leader said. And you know, those people like myself who've been shielding would possibly take more efforts to protect themselves and their families. if you know, just for a short intermediate time or however long they feel is safe. So could the leader please tell me if we have any plans to produce such maps for our different wards? Thank you.
Currently, at this moment in time, the straight answer to that, Councillor Edwards, is no. I know that one or two other county boroughs are in fact producing maps. My own personal opinion of this is that this thing is moving so fast that the maps are literally only worth 24 hours. And when you then have cluster outbreaks, your area could be shown as safe today, and then you could have a cluster outbreak, as you've just highlighted with Aberpergome, that then would change that map. We haven't got the resources or the accurate data to keep that information as accurate as we like. And don't forget, it's produced not only within the county boundary, but it is data that's used from Public Health Wales and the Health Board, and we then get that data from them. So it's their data, but it is not as accurate as it is being perceived to be, for the simple reason it changes on a 24-hour basis as per the data that you will see being published by Public Health Wales. So currently we've got no plans to produce those maps for the reasons that I've outlined. But I also emphasise that this pandemic, again in this second wave, I believe is moving more quickly and more rapid than it was on the first. The strength that we have here is that whereas we were fumbling in the dark to find solutions to problems in the first wave, we've now got a very good set of rules, guidelines and policies and procedures that we can now tweak and base our way going forward as a council and build on that experience that we've got. I hope that answers your question.
Thank you, Leader. Councillor Stephen Hunt, then followed by Ellen Kerry-Clark. So, Councillor Hunt, please.
Thank you, Mr. Mayor. Rob, Leader, thank you for the update on how you propose that we go council business as normal, as best we can during these very difficult times. I have to say, they are very scary times. I endorse and support the comments you have made in respect to how we deal with it. I'm 100% behind your views and the vision you have. However, I think, are we looking at anything further, more radical? I mean, I'm at an age as well where it's scary. I'm first to admit, these are very scary times. I mean, we've only heard today about the maternity units, where the outbreak of COVID in the hospitals again, in the cardiac parts of Morriston, Singleton. It's all probably getting a little bit out of control. You quite rightly stated that the rise in figures are escalating. You may have touched on some of the reasons, but we're in a better place to deal with them. But I still think that the public's help and support is paramount, of course. Without them delivering some of the points you've raised, we might be fighting a losing battle. But I wondered, from the council perspective, apart from what you've already announced and said, are you discussing across with Welsh Government and other health professionals more radical things going forward, possibly? Because if it continues to rise, then whatever we are doing is not working. So I just wondered, is there any further information available from your cabinet, yourselves and Welsh Government at this time? Thank you, Mr. Mayor.
Is that speak for, do I know if a fire or circuit breaker is coming in, Councillor Hunt? Because I think reading between the lines, that's what you were alluding to. The short answer to that is, I've already had 3 meetings this week with ministers, and I continue to meet with ministers, my Labour leader colleagues and the WLGA with all 22 leaders. When I genuinely tell everyone in council today that this is a fast-flowing, changing scenario on an hourly basis, I genuinely mean that. And I never try to mislead council, but I could tell you something today that may not be applicable in half an hour's time. I will not deceive you. There has been chat of radical talk, but that's what it is at the moment. It's radical talk. whether in fact these chats and potential courses of direction will come to fruition by Welsh Government. That will be a matter for them to make any announcements, but they have been consulting with councils over basically what's the next step. I raised, in fact, with council leaders on the WLGA, it's all very well to talk about transition and recovery, but what exit? What exit from local restrictions? What exit if our numbers go down, but we are surrounded by those that have still got high numbers? How will that affect me as a local authority? But you see, today's figures actually just give us 1 point difference from Swansea. Now, bearing in mind, Swansea went into lockdown quicker than us, but we are now at the same level with them, and we are continuing to rise, although there has been slight dips. Caerphilly were the first county borough to go into lockdown, and last week they were down to 50, so they were on the border of going from red to amber, and overnight, yesterday, Caerphilly's figures were 90, so Caerphilly's figures are going the wrong way. I think that consideration has to be given to alternatives. You are right. I think our members of our community, I'll use the term depressed, but I don't mean it in its clinical sense, are depressed with the restrictions that we place on people's lives, but it is there to protect their lives. And as I said, the quicker we get out of this, of the community themselves. So we need to, as community champions, push the message of social distancing, of making sure that households, one of the biggest problems we got is people think because we had the relaxation in the summer that things are almost back to normal. Well, they're not. The paper today and yesterday shows that hospital infection is now throughout our hospital community. The same is applicable to Rhondda and Tav, where there are 4 major hospitals in that area have now got COVID, one of them to the point that they've had a serious amount of deaths and has been closed for admissions. It's a pattern that's been replicated right across the whole of Wales. And if that is the case, then Welsh Government possibly need to consider a whole of Wales solution to this problem. Thank you, Mr. Mayor.
Thank you, Leader. Before I call in Councillor Helen Kerry Clark, Councillor Carolyn Edwards, do you wish to come back with a comment, or are you satisfied that Mrs. Karen Jones have dealt with your query?
I did want to come back, Mr. Mayor. I just wanted to ask a question. If we're not going to have these maps, would it be possible to have contact immediately that if there is a spike in our area? Because as I said 2 weeks ago, I had a bit of difficulty, despite the fact that we'd had that seminar on TTP, that I had difficulty in finding out who I should contact about this spike. So if we could have a list of contacts, or if those officers responsible for controlling spikes, tracing, testing, and so on, if they could ring the local member immediately, that would be a big help. Thank you, Mr. Mayor.
Like him in, Mr. Mayor.
Yeah, thank you.
Perhaps if some people don't really understand the dynamics and how this system works, there is a thing called an IMT, Incident Management Team meeting, and these take places. They are chaired by the Health Board and driven by the data in relation to Public Health Wales. This is a multi-agency approach where you can have anything up to 30 or 40 people from a variety of organisations that meet on that. And their role is to assess anything in the area. Now, when we can get information, we do. We see this information retrospectively and it's sent to Welsh Government. It's not necessarily sent direct to us. I recently made a request that I need to have that information to make informed decisions that you are outlining in relation to this. I don't think it's going to be a practical way for them to actually start ringing local ward members. What I will give you is an assurance that we will look into this matter, and if we have serious concerns of outbreaks, clusters that give us cause for concern, then I will do my utmost to ensure that officers make local members aware within reasonable and making sure that we're not distracting officers from the important role that they do.
Thank you, Leader. Okay, Councillor Helen Kerry Clark next, followed then by Councillor Alan Llewellyn. Councillor Clark, please.
Thank you. Leader, you said in your little speech then that people should get tested at the mildest of symptoms. Given that, anecdotally and in news reports, there's a range of symptoms that people don't get tested for, such as diarrhea, sore throat, skin problems, especially in children. What discussions have you had with the Welsh Government about expanding the symptoms with which you can test?
I'm no medical expert. We rely on the SAGE advice and the lead clinician, Dr. Frank Atherton, to provide the advice in relation to testing. And currently that revolves around the temperature, persistent cough, loss of smell or taste. I'm not saying that there are other symptoms out there that may not affect COVID, but they're not being brought into our domain. And don't forget, the problem that you've also got as far as symptoms are concerned, people have COVID and they're asymptomatic and they show no symptoms whatsoever. So it's very much a little bit of a guessing game. And sometimes those that are asymptomatic, because they've come into contact through the TTP process and are told to get a test, are subsequently proving positive with no tests at all. So it is a bit of a lottery in that respect. But we're constantly having conversations with Welsh Government. That criteria for testing hasn't changed as far as I'm aware, but as I said, we are advised by Welsh Government, by their SAGE advisors, by what is produced at UK level, and the 4 home countries actually meet on a 4 home countries basis to discuss the science and the medical information behind that. So I am having these discussions, but at this moment in time, we've not been made aware of anything that should change that regime for symptoms being shown.
Thank you, Leader. Councillor Alan Llewellyn, please.
Mr. Mayor, thank you. And sorry that I lost connection earlier. The internet has been going down briefly here, but I have picked up on the discussion, and I welcome the assurance that Councillor Rob Jones gave to Carolyn Edwards earlier about trying to ensure that in the case of serious outbreaks that local members are kept in the loop. I do think that's important. And staying for a moment on the issue of the data, I think that the more information that we can make available, and you know, it needs to be authoritative. It needs to be on an agreed basis with the health authority. But then the clearer that people will understand the situation we're in, because I think, you know, anecdotally, people are making assumptions about the prevalence of the virus in our areas. I think people will be surprised actually to know the extent to which it is expanding within the communities, you know, across the whole of the area, because, you know, you're certainly picking up more information that people are sharing personally, saying yes, they really have experienced this, you know. So I think that, you know, the figures that the council quoted earlier, the increase from a very low figure, very low prevalence at the end of September to 128 plus cases per 100,000 now. I think the simpler that we can get that message across, the more that people actually will realise, you know, the extent to which the spread is actually happening. And that information is not always easily available, despite the media coverage. Because if you look at the Public Health Wales website and their daily statement, you know, that information for localities like ours is not always readily available. So I think we do look at how we can try and get that information out as clearly as possible. And you know, that's something that we've discussed, Leader, and you know, I'm grateful for the email that I picked up just before the beginning of the meeting from Mrs. Karen Jones on it. But I think we need to keep on looking at that. And just to conclude on the TTP. Unfortunately, I wasn't able to join the session again because of internet problems here, and I did leave a message that I think was passed on to the team presenting. I did pick it up on the recorded version afterwards. That, you know, I appreciated the work of the TTP. For instance, that there were cases in local schools in my area, and you know, the support that they gave was tremendous. You know, the promptness with which they acted. So I think that my question really, as far as TTP, is how confident are we that there is sufficient capacity as the rate of the virus continues to increase? You know, I think that the tracing part, one advantage that we have in Wales compared with the situation over the border is that the TTP is still very largely based on local authorities and local health boards, as opposed to, you know, be dependent on a central system that doesn't know the area and doesn't know the communities that they're communicating with. But nonetheless, there are still concerns about the testing capacity in particular, because we're tied into the Lighthouse system by a Circle or whoever the providers are, that are caused, you know, concern across the whole of the UK really. So if we're facing you know, further increases, are we confident that we've got the capacity locally to ensure that the number of tests can be sustained?
Mr. Mayor, at this point, the expert on TTP is online, which is Mrs. Nicola Pearce. Could I defer to her to give that answer?
Yes, yeah, I was just about to call the Director of Environment. Mrs. Pearce, please.
Thank you, Mr. Mayor. Just to advise members, as they're aware, there is two means of securing a test. It's either via the telephone number, which has been published by both MPT and Swansea Bay University Health Board, or via the online portal. Now, those seeking out a test will be directed to a number of different testing units which are available to our communities. They include the testing unit down in Margam, which has been in place since early in the pandemic. There is also the testing facility at the Liberty Stadium, which again has been in place for some time. Supporting those original testing units, working with the health board, additional facilities have been provided. There is soon, or it may actually be operational already, a walk-in facility in the Grand Theatre in Swansea, where you do not have to book a test, you can walk in. We also have 4 mobile testing units which are operational within Neath, Talbot. You have to book a test to go to those units, and they are located in the Keys car park in Baglan. There is a facility in Gwaun-Cygwyn. There is also a facility in Neath, and I believe there is also a facility up in the Dub workshops up in Onllawn. Those are the originally identified locations. I am mindful that there are also some in Swansea, and for various on-the-ground reasons, constraints possibly associated with highway-related issues, some of those locations have changed. For example, the Keys has only recently come online, and it was originally supposed to be down in Aberavon Leisure Centre, but for reasons associated with highways and the restrictions of the car park, it was relocated. So there's plenty of testing facilities available within the authority for our communities. As we know, the Health Board and Public Health Wales are responsible for the actual testing in association with the private sector. Members will be aware of the Lighthouse labs, as mentioned many times on the news. Now, we as an authority have no control in relation to the turnaround of the testing. We appreciate that the testing appeared to improve in terms of the speed of those tests, but we are having glitches. We had one over the weekend and we had another one this morning. I think we believe it's as a consequence of the scale of the testing being undertaken. In terms of the actual support that the authority can provide and are providing, we, as you're aware, are running the TTP system in terms of the tracing of cases and the tracing of the associated contacts. We put a system in place early on in the pandemic where we deployed staff from within the existing NPT structures. We have subsequently supplemented those staff numbers with externally recruited personnel. Those staff are working really well at the moment. We have, however, had to redeploy staff who have gone back to their substantive post to ensure that we have the capacity to respond to the increasing number of cases. That recruitment and that redeployment of staff is going well also. We had around about over 50 cases on one day over the weekend. We managed to get through all of those cases without traces. So that was quite a feat, because it takes about 3 hours to go through each case to try and track down where people have been and who they've been in contact with, and get those contact details. So the staff are doing a marvellous job to keep on top of this. In addition to that, we've undertaken a recruitment exercise to recruit additional environmental health officers to work on our regional team. Now, the regional team are dealing with the complex clusters. So mention was made earlier on of the Aberpergam mine. We had a significant number of staff in that facility which were affected by the virus. And the regional team moved in to try and investigate and put mitigation measures in place. And that mine was supposed to be reopening today, following the implementation of those mitigation measures. We've also had issues which are very difficult to mitigate down in the Tata Steelworks, where there are a number of parts of that plant which are business critical to the continued operation of that plant. So our regional officers are working with senior management within Tata to ensure that the workforce and the surrounding communities are protected without undermining the viability of that plant going forward. So all of our staff are involved in that exercise, and it's quite intense. In order to support those staff, we have recruited additional enforcement officers, and they should be in post this week or next week, and they will support as opposed to replace our environmental health officers in undertaking the investigations and ensuring our communities and businesses are operating and conducting themselves safely. So that is a brief update on what our TTP service is doing. As I say, it's very intense at the moment, and we're trying to do everything we can to communicate with locally elected members. And because, as the leader has indicated, it's a constantly changing picture, it is difficult to try and give you up-to-date communications as and when they happen, but we are trying to do our best. Thank you, Mr. Mayor.
Thank you, Director. Leader of Council, please.
Thank you, Mr. Mayor. I just wanted to come back on something that, listening to Councillor Edwards and reflecting on what she actually said about trying to get the message to communities and how serious this is. I think if communities don't realise how serious this pandemic is, then they'll never will recognise it. I am getting letters from members of the community that are asking me to represent them at Welsh and UK levels, to actually decry the actions. The terminology that's being used is they were born free, they live free, they want to die free, they're taking their freedom of speech away, that this is a made-up virus, that this is a conspiracy that has been put forward by the UK government or the Welsh government, or even as far as the local authorities. If they want to deny this virus, then go and ask to speak to someone who's lost someone through this pandemic. Go and speak to a husband, a wife, a brother, a sister, a relative, a mother, a father who's actually succumbed to this virus. People need to start realizing this virus does kill. It doesn't kill everyone it comes into contact with, but it does kill. We are in a serious time. And to be honest with you, my own personal opinion is we can draw as many maps as we like. We can highlight as many areas as we want to that have higher rates of infection than others. This is an invisible enemy. It doesn't respect boundaries. It doesn't matter what ward it's in. It doesn't matter what county borough it's in. This is all around us, and it's in our communities. And people have to have responsibility on an individual level in our communities to make sure that they do all that they can to make sure that this virus is kept to its lower possible level of infection, and we get rid of it by that means. And until such time as a vaccine is produced, we are always going to be susceptible to this virus. So that's the message we need to send out. It doesn't need a boundary. It crawls over boundaries, no matter where they are, whether they're in one ward or another, across the road from you, over the hill into the next county borough. The message we've got to make very, very clear to our communities, it's out there, it can kill, and we've got to do all that we can to make sure that we do our best to prevent that infection spreading. Thank you, Mr. Mayor.
Thank you, Leader. Councillor Alan Llewellyn, I believe you want to come back and ask an additional question. Councillor Llewellyn, your microphone is muted.
Yeah, sorry, Mr. Mayor. Everything's responding quite slowly here. Yeah, no, I fully take the point that the Leader of the Council has just made. It wasn't the question I was going to ask, but you know, I think the information is not to try and convince those that deny the existence. I get those communications as well, and you know, you're not, you know, it's not going to convince people that have various conspiracy theories. You know, it's information for the, you know, the bulk of our people who are worried and confused and, you know, need to have that information. But I'm sure that, you know, basically we're on the same lines on it. But the question I was just going to ask was on a point of detail from Nicola's information about the testing centres and so on. I think the use of the local 01639 number has certainly improved. It's the health board number. It's certainly improved. You know, you don't hear now about people being referred to the West Midlands or Aberystwyth or whatever. You know, people are being directed to far more localised. And you know, just to check that for the purpose of receiving tests, that people are able to access on a cross-boundary basis. You know, although we have different lockdown areas, for instance, if it's appropriate for somebody to go to Swansea, they can go to Swansea and vice versa for the purpose of having a test.
Okay, thank you, Councillor Llewellyn.
Yeah, sorry, it was a question. It was to Nicola, really, just asking for confirmation on that.
Mrs. Pearce, do you want to respond to the question, please?
Sorry, Mr. Mayor. In terms of sorry, I lost the sound part way through. I'm struggling to keep up with the quality of the connection today. So I didn't catch all of that. So I do apologise. I believe it was in relation to testing. But can Councillor Alan Llewellyn just briefly summarise the question again? I'm really, really sorry.
Yes, Councillor Llewellyn, can we have a very, very brief question, please?
Yes, Mr. Mayor, I was saying that the use of the local 01639 health board numbers certainly improved the way people get referred to much more accessible, and there are more testing stations. I just wanted to check with Nicola that for the purpose of travelling out to the county borough to receive a test, that is basically allowed. So, you know, if the capacity available in one of the Swansea centres or whatever, and vice versa.
It is one of the exempted essential reasons for travel. So if you are accessing a testing facility which is out of county, then you are allowed to leave the county for that purpose. Sorry, sorry, my connectivity is pretty poor today. I apologise for the delay in responding.
I know the feeling. Thanks.
No problem. Okay, I've received no further indications from members. So can I say that concludes the business before us this afternoon, other than for me to take the opportunity to thank you all for your attendance here today. Please take care and stay safe. Thanks very much.
Thank you, Mr. Mayor.
Thank you, Mr. Mayor.
Thank you, Mr. Mayor.
Thank you, Mr. Mayor.